March is National Endometriosis Awareness Month, an important time to educate ourselves on red flags and warning signs you need to look out for.
Dr. Wendy McDonald joins us now with more. And you were just saying endometriosis is difficult to diagnose.
Yes, it is. So endometriosis is the presence of a certain type of tissue that's supposed to be on the inside of the uterine lining, but it's present outside of the uterus.
Okay.
So it's in the pelvic floor, it's in the abdomen, it can be on your ovaries, it can be on your tubes, it can be actually on your bowel. But it's actually really hard to make that diagnosis because in order to really know for certain that a person has it, you have to do surgery and find it and look for it.
Okay.
So we can diagnose it or presume that it's there without doing surgery, but it's hard to make that call.
And if you go undiagnosed with it, can something happen?
The biggest thing is really bad pelvic pain, like severe pain with your periods. And that's kind of the hallmark that I hope that we can take away from this is like if you're having period pain that stops you from going to school or work, like it could be endometriosis. And sometimes we have to treat it as such and then see if the treatment works, and then you can say, okay, that probably was that. But if you don't treat it, often the repercussions can vary to nothing at all or to something like infertility or problems with conception later.
Okay, so we know pain is one of the red flags. What's some more red flags that we should be looking out for?
I mean, pain is the main one. And so it can be pain during your period. It can be pain outside of your period. Some people will have really bad pain when they have to have bowel movements. Some people will have really bad pain when they have intercourse. It can really vary, but it's usually pain within the pelvis or within the pelvic floor. So like it can affect your ability to urinate comfortably. There's a lot of like crossover with endometriosis, and the severity of it can vary from one person to the next. But one thing is, you know, I think unfortunately as people who have periods, you can be told like, oh, that's normal. Like it's normal to have bad pain. It's normal to be like curled up in a ball on the bathroom floor every month. Like that's not actually normal. And there are ways to reduce those symptoms.
Also, is it breakthrough bleeding or heavy bleeding is also a symptom, which again, could just be normal, but not.
Yeah, endometriosis can cross over to things like fibroids and polyps, which can also cause heavy bleeding. Endometriosis doesn't usually cause heavy bleeding, but bleeding disorders are also something that I think one should know about and be looking out for if you're somebody who, say, like literally hemorrhages every month. If you're bleeding past your period products within an hour or 2 hours, you're soiling your clothes, you're soiling your sheets. Also not normal, also reasonable to come and get checked out, because now we need to make sure, yes, do you have fibroids, do you have polyps, do you have endometriosis if you have severe pain, but also do you possibly have a bleeding disorder like a hemophilia where you could bleed excessively because there's actually blood clotting problem in your blood.
So how do you go about treating this?
So endometriosis, one of the first kind of line treatments is birth control. Because it in essence replaces the hormones in our body that are feeding it. Kind of like certain types of hormones in our body that just naturally exist feed endometriosis. I think of endometriosis like weeds. You're supposed to have a certain garden, you're supposed to have your like grass, but if you have little, little weed growing in between your rocks, little crabgrass, you want to like spray that or pull it up. And so our normal hormones will feed and water those weeds, but if we can replace them with different hormones, we actually can let them fizzle down and not be as active. So birth control is one of the first options. There are other hormonal modulators like changers that can actually also reduce that. And some people need surgery. Some people need to go in and literally go and pull it up and, and cut it out and burn it or ablate it.
I remember that Amy Schumer was a big advocate of talking about it because she was able to get pregnant but had endometriosis and had her uterus removed, a hysterectomy after her child was born. Does that happen a lot, or does it usually more of a black and white line of it causes a lot of infertility?
It's more of a black and white line. I wonder if I have to go back and look at that story to see why she had to have a hysterectomy as a result of delivering, because usually endometriosis wouldn't do that. But endometriosis can cause severe enough pain where a person could need a hysterectomy in the future. Yes, that is possible because of the severity of their symptoms and how bad their pelvis is kind of like the shape that it's in.
But we're also talking about bleeding, not just from the vaginal area, nosebleeds, bruises.
I mean, so if you're somebody who gets cut and like you have to hold pressure on that for way longer than a friend, if you're somebody who bruises, like you knock into something like we all do, I'm clumsy, and then you're like, you have this big, huge bruise, you should be wondering, like, could I possibly have a bleeding disorder? Bleeding gums, I mean, you might just go to the dentist, but like, say you just, like, all the time your gums are bleeding, that can also be a sign of a bleeding disorder. And one of the biggest signs for women is really heavy, long periods, especially in adolescence. Like people start their periods when they're 13, 14, 12, and you know, everybody's period's a little off at that point, but you shouldn't be bleeding through clothes and, you know, having to change your sheets at night. That's a reason to check in with your provider.
Gosh, there's so many gray lines there too. So you're saying you got to go to the doctor. I'm really fair skinned. I bruise all the time, but you know, when do you know the difference is the problem.
Exactly.
Dr. Wendy, thank you so much for joining us. Follow her at Dr. Everywoman or loopobgyn.com. Some great information out there. Thank you so much.
Thanks, Dr. Wendy.